Menopause isn't just about hot flashes. It is a major shift in a woman's metabolic health. Beyond hot flashes and mood changes, menopause affects your metabolism, your blood pressure, sugar, cholesterol, your body weight, and so much more. And these changes can impact your long-term health. Hi, I'm Dr. Bazgha Khalid. I am an internal medicine and obesity medicine board certified physician, and today I'll talk about perimenopause and menopause, what it actually is, how it impacts our health, and what are the things that we can do to improve our metabolic health. What is perimenopause? Perimenopause is the transition years before menopause, and perimenopause may start 10 years prior to menopause. So you may be as young as your late 30s or early 40s and be in perimenopause. Hormones, especially estrogen, begin to fluctuate. Common symptoms include irregular periods, hot flashes, night sweats, mood swings, sleep problems, weight changes, and so much more. During perimenopause, some women may experience brain fog, lower energy, joint pain, vaginal dryness, and the list goes on and on. What is menopause? Menopause is defined as 12 months without a menstrual cycle. The normal age range is anywhere from 45 to 55 years. The average age in United States and Western countries is 51 years. Estrogen and progesterone levels are now much lower, and that not only impacts our reproductive health, but also our physical and mental health. Why hormones matter for metabolism? Estrogen isn't just about fertility. It plays a huge role in body's metabolism. So let's start by understanding the main roles of estrogen. In the reproductive system, estrogen regulates the menstrual cycle. It helps the uterus prepare for pregnancy, helps support the growth and health of vagina, ovaries, fallopian tube, uterus. Estrogen also helps with bone health by maintaining bone density, by balancing bone formation and bone breakdown. And therefore, low estrogen levels after menopause is a major risk factor for weak bones or osteoporosis. Let's talk about how estrogen helps metabolism and fat distribution. Estrogen helps regulate how fat is stored. Women store fat mostly around their hips, thighs, buttocks before menopause, the pear-shaped. That fat pattern actually is metabolically safe, as fat mostly is stored under the skin or subcutaneous fat and not deep fat or visceral fat. I actually have a video explaining the differences between these two fat, and I'll post the link below. Estrogen also supports insulin sensitivity and protects against diabetes. It also helps with the cholesterol balance by lowering the bad cholesterol or LDL and by increasing the good cholesterol or HDL. Estrogen also protects our cardiovascular system by keeping our blood vessels flexible and promoting better blood flow. It also lowers our risk for atherosclerosis, which is the hardening of arteries before menopause. Estrogen also helps with our brain and mood by influencing serotonin and dopamine, which have a positive impact on our mood, memory, and sleep. And therefore, low estrogen levels are linked with brain fog, mood swings, anxiety and depression, and perimenopause and menopause. Estrogen also helps with our skin and hair health by supporting collagen production, maintaining skin elasticity and thickness, and helps hair growth and reduces hair thinning. Estrogen is also essential for maintaining good bladder and urethral health, as well as supporting our immune functions. Estrogen isn't just a reproductive hormone. It is a whole body regulator that protects bones, brain, heart, skin, and metabolism. That is why when estrogen levels drop during perimenopause and menopause, all of these systems are affected. Let's talk about effects of low estrogen. When estrogen level drops, the body becomes less sensitive to insulin, and therefore insulin resistance increases, which causes the blood sugar to go up, and so does our risk for prediabetes and diabetes. LDL, or the bad cholesterol, goes up, while HDL, or the good cholesterol, goes down. Blood vessels become stiffer, that leads to high blood pressure. Muscle mass decreases, the metabolism slows down, it becomes easier to gain fat. Fat distribution changes in the body, which means more belly fat than fat around the hips and thighs. This belly fat is mostly deeper or visceral fat, which is very metabolically active and causes a lot of inflammation and metabolic issues and health problems. I have a video about this in the description below. Low estrogen, common in perimenopause and menopause, can lead to hot flashes, mood swings, brain fog, weight gain. It also increases the risk for bone loss or osteoporosis, high cholesterol, heart disease. Many women also notice skin thinning, vaginal dryness, reduced energy, brain fog, and so many other symptoms. Large studies, including the Women's Health Initiative, confirm that menopause accelerates cardiometabolic risk. So let's talk about the metabolic health challenges during menopause. Weight gain, especially belly fat or the visceral fat, which is metabolically active, causing inflammation and risk for chronic diseases like high blood pressure, high cholesterol. Also, the risk for diabetes goes up because of the insulin resistance. The risk for high blood pressure goes up because of stiffer arteries and less vascular protection or flexibility. Cholesterol changes leading to higher LDL, which is the bad cholesterol, and lower HDL, which is the good cholesterol. Bone health declines, increasing our risk for bone loss, osteoporosis. How to protect metabolic health during perimenopause and menopause? Nutrition is the foundation. Prioritize protein. Protein preserves muscle, prevents fat gain. Cut refined carbohydrates and added sugar to help lower your insulin resistance. High fiber diet supports gut health, lowers cholesterol, and helps balance hormones. Healthy fats like omega-3s, fish oil, flax seeds, walnuts are good for your heart. Watch portion size. As metabolism slows, so calorie needs decrease, and it becomes essential to adjust our nutrition. Exercise is essential to support your metabolic health during perimenopause and menopause. Strength training. It is crucial to maintain muscle and boost your metabolism. Women can be as young as in their 30s and start to lose muscle. Therefore, strength training is essential to preserve and protect your muscle. Aerobic activities like walking, swimming, cycling lowers your blood pressure, improves your cholesterol and your heart health. Flexibility and balance, yoga, Pilates for joint health, stress relief. Healthy lifestyle habits can help support your health and your metabolic function as well, especially during perimenopause and menopause. Sleep 8 hours. Poor sleep worsens hot flashes and causes insulin resistance. Stress management, meditation, deep breathing, counseling can help lower your stress hormone or cortisol, which actually fuels belly fat and inflammation. Quit smoking, limit alcohol. Both of these are worsening factors for menopause symptoms and also metabolic risk and heart disease. Role of hormone replacement therapy. This is one of the biggest questions women wonder and ask. Hormone replacement therapy can be very beneficial as it can improve your hot flashes, night sweats, mood, sleep, and so many other symptoms related to perimenopause and menopause. Hormone replacement therapy can also help preserve bone density. Hormone replacement therapy can also help improve insulin sensitivity and cholesterol when started early in healthy women. Let's talk about risks for hormone replacement therapy. Hormone replacement therapy may increase risk for blood clots, stroke, or breast cancer in some women. Not recommended for women with certain types of cancers, clotting disorders, or high cardiovascular risk. Best to discuss the benefits and risks for hormone replacement therapy with your gynecologist to tailor this to your health needs. Recent studies suggest that if started within 10 years of menopause and in healthy women, hormone replacement therapy can be safe and beneficial, but it's not for everyone. It must be individualized. Let's talk about non-hormonal medical options to treat your metabolic dysfunction. Medications for blood sugar like metformin help improve your insulin resistance and help decrease the risk for diabetes. Cholesterol lowering medications. If your LDL is high, you should talk about cholesterol lowering medications like statin with your doctor. Blood pressure medications. If you notice your blood pressure to be staying high, please talk to your primary care doctor about starting a blood pressure medicine. Non-hormonal treatments for hot flashes. Certain antidepressants, gabapentin, and other medications and lifestyle modifications can be very helpful. GLP-1 medications like Wegovy or Zepbound can be also very helpful and beneficial to treat excess fat gain or obesity. So here are key takeaways. Menopause changes metabolism in ways that raise the risk for diabetes, heart disease, and weight gain. Nutrition, exercise, sleep, and stress management are powerful tools. Hormone replacement therapy may help, but it isn't for everyone, and best to discuss this with your gynecologist. Regular checkups, labs, and preventive care are critical in midlife. Menopause is not the end of your health. It is the beginning of a new chapter. With the right lifestyle choices, medical care, and hormone replacement, you can protect your metabolism, your heart, your bones, and your quality of life. If this video was helpful, please like, share with a loved one, and subscribe for more. Stay well and healthy. Bye for now.